Unfortunate, isn't it? Such a young girl. Let's in fact get you a quick glimpse of how serious the problem of heart attacks in India really is. Well, Indians with heart attacks 10 years earlier than the West. In West, it is mostly people in the age group of 50 onwards who are dying of a heart attack. In India, it is 10 years younger. It is 40 and above people who are much more susceptible to heart attacks. 45% rise in the heart attacks, which has been reported in young adults of India. 1.3 million deaths have been reported of heart attacks annually in India as well. In fact, 1 in 5 heart attacks have been recorded in patients who are below 40 years of age in India. This is how startling the stats are. 45% of the heart attack deaths are within the age group of 40 to 69 years old. So what really are the things that are ailing the young hearts? What really is ailing young India's heart that is leading them to drop like that of a heart attack? Here are some of the reasons on your screen. Chronic stress, depression, smoking, air pollution, excessive heat, one of the reasons. COVID-19 infection, that is also one of the possible reasons that cardiologists have pointed out. Fast food, sugary drinks, too much alcohol, no exercise, sedentary lifestyle. These are just some of the reasons which has led to all the spike that we have seen when it comes to heart attacks. But 23-year-old Parinita is not the only one. Remember, you have had several popular stars in the past as well, some of them very fit, healthy and young, having died of heart attacks as well. You had TV actor, remember Siddharth Shukla? Well, he had died of a heart attack in September 2021. Remember, he was merely 40 years of age when he died. Then you had Haryana BJP leader and actor Sonali Phogat. She also died of a heart attack when she was in Goa with her friends. This happened in August 2022. What was her age? Well, this is Siddharth Shukla, of course, merely 40 years old. You had Sonali Phogat at the age of 43. She too had succumbed to a heart attack. Then you had Ashok Mali. He's widely known as the Garba King. In the middle of a performance, Ashok Mali keeled over and died. He passed away due to a heart attack at the age of 50. And remember, he was merely in the middle of a performance when he died of a heart attack. Then, of course, there are others, such as 52-year-old man in Noida. Here you can see him, 52-year-old man in Noida. He died of a heart attack while he was playing badminton. They tried to resuscitate him, but they couldn't. These are just some of the examples. So let's go across to the cardiologists. Some of the topmost cardiologists are joining us here on the show so that we can put some of your questions, some of my questions to them as well. We are being joined right now by Dr. Prashant Pawar, who is a consultant interventional cardiologist at the Fortis Hiranandani Hospital of Navi Mumbai. We are also being joined here on the show by Dr. N.N. Khanna. He's a senior cardiologist and an advisor to the Apollo Group of Hospitals. Dr. N.N. Khanna, I'm going to come to you first because we are trying to wrap our brains around as to what really is happening. Why is it that in the West, it is predominantly those in the age of 50 who are dying, but in India, it is 1 decade earlier? Why are those in their 40s today at greater risk of a heart attack, specifically in India? What's causing it?
Can you hear me?
Yes, we can. Go ahead, Dr. Khanna.
Okay. So let's put things together. Indians genetically are most predisposed race in the world to develop coronary artery disease. And then now it's compounded with the new age, lifestyle where you don't exercise, where there is a lot of stress, there's a lot of pollution, smoking, high cholesterol, lack of sleep, and very poor diet. And so all these combined, and also post-COVID, that could be one of the reasons also, all combined, and excessive gymming is leading to this heart attack because we are genetically predisposed because of our good lifestyle earlier, say 2 decades or 2 generations earlier. We were actually saved because our lifestyle was good. Now it's a combination of bad genes and a very poor lifestyle and a lot of stress, which is leading to this.
Well, Dr. Pawar, here is the problem. We all know what is the right way forward because many are saying it's that sitting is now the new smoking. But why are we getting it wrong? What's leading to young India not following the best health practices? Is COVID one of the reasons? Because this is something that many have been talking about, that it could be post-COVID infections which may be lingering on.
I won't say that COVID itself, but definitely post-COVID and during COVID, a lot of sedentary lifestyle has occurred. People have sorted out to alternative means to relieve those stress of jobs, financial aspects, for smoking, alcohol, and lack of exercise. That is main problem. And all these platforms which deliver all the junk food that has been so rampant right now. I won't name those companies, but everything is all processed food and junk food. So I feel main culprit is what Doctor also spoke right now, is the diet, what we are lacking, we are more for this processed food and no physical activities. May have seen many of these actors also, suddenly they are going for this all active gyms and all, and so many years they have not done exercise, and sudden high endurance activities have also lead to sudden cardiac death. So that is also a problem with the plaque ruptures. So I feel main is lifestyle, and all the youngsters are following this main of this all this your actors and all promoting all this smoking or this vapes and other things that I think should be avoided, So main is to cut down on this addiction part, the smoke in any form, either oral or inhalation, that is bad.
Absolutely. And also there's air pollution, which is adding to all the grief, isn't it? Now, Dr. Khanna, yes, air pollution is one of the reasons as well that we have looked into it. Now, Dr. Khanna, this is something that Dr. Pawar has very rightly put out. We have these videos on our screen. We are looking at Siddharth Shukla, for example, someone who was merely 40 years of age when he died, and he was a fitness freak. He seemed to be doing everything right. He seemed to be following the right diet, the right exercises. What happens then? Why are there fit people? Even the Dandiya King, they were all dancers. They all seem to be very healthy. How can this young girl, for example, who died, a 23-year-old, doesn't seem like she had a long, unhealthy diet lifestyle. What's causing deaths in this age group?
Okay, so let me put this in perspective. Let's come to this young female who was dancing and just passed away. This is probably not a heart attack, it's a cardiac arrest. So anybody who dies suddenly because of heart condition may not be having a heart attack. That's a very different thing, where the blood clots in the heart arteries and there is no supply to the heart muscles, and that is when the patient either dies of an electrical death or has severe pain and sweating and ghabrat and fall of BP and breathlessness. That is the heart attack we are talking about. What this female had probably is a cardiac arrest, which is an electrical death. Young people often die because of electrical death. They do not have risk factors like what we talked about, but they are genetic risk factors like hypertrophic cardiomyopathy or different other cardiomyopathies or channelopathies, and that with a little trigger, which could be just nothing, or an anxiety or a stress or extreme emotions or even fast food or a caffeine can actually, or alcohol can cause this sort of a arrhythmic death. But one has to understand the two are different, and to prevent these, people who are in active sports should get an echo, and people should know how to do good CPR. And if they know how to do a CPR, then the bystanders can actually save them and save them probably for life.
Absolutely. And that's very good advice. Get an echo done. Get your tests done in time. Make it an annual routine affair that you get your tests done, your annuals done, to ensure that if there is a problem, it gets detected on time and it's not too late. Thank you so much, both the doctors. But do stay on with us, because several of our viewers are calling in. They too want to ask you some questions. We have one of our viewers, Dr. Ram, calling us from Chennai. Go ahead. What would you like to ask?
Yeah, good evening. I have a couple of points to make. The first thing is the big hulala happening about the 60 hours and the 90 hours week hours. So basically that is spoiling the fabric of what is called the family time, and that in turn leads to people not cooking at home and also having a very unhealthy lifestyle.
Absolutely.
That is one. The second point is the movies which have a lot of scenes that talks about smoking. I mean, if people are happy, they drink. If the people are sad, they drink. If people have to go out, they drink. And they have a small disclaimer down there saying that, smoking or consumption of alcohol is injurious. How does it stop people from actually, doing those things? I mean, there has to be complete responsibility of the actors who actually don such roles.
So that's an interesting point that you are making. Interesting point that you have made. It's not always hereditary, but it could also be lifestyle choices. Of course, there's a larger debate about OTT platform and how that needs to be regulated. But that aside, these are lifestyle mistakes that we are making. I'm calling it a mistake that we have made. Another one of our viewers, Anil, is calling us from Bengaluru. Go ahead, Anil.
Good evening, Megha. Just I wanted to say that 90 hours working or 70 hours working as well as junk food may cause the heart attacks. This is what I believe.
Absolutely, and I think the doctors would agree with that, isn't it? Dr. Pawar, 90 hours, 70 hours, these are some of the suggestions coming in. That could be one of the reasons.
Yeah, absolutely. Because no one speaks about the stress, everyone speaks about all these addictions and all. But stress is a main problem, main culprit for rise in the blood pressures also. We are seeing so many youngsters coming with hypertension, all because of this stress, deadlines, and working too long, work from home, but their hours have exceeded 16 hours, 14 hours, which is sky high.
Work hours, a lack of work-life balance, the lack of exercise and the lack of healthy food. And of course, lifestyle choices. If you want to stay healthy, ensure that you practice healthy practices as well. And that's going to go a long way. Thank you so much, Dr. Pawar, as well as Dr. Khanna, for joining us here on the show, as well as all the viewers who have joined in with your calls and watching us at home. Hopefully, we are going to be together making a fitter India. Without a short break.